So when discussing a case investigation and what a case is, let's start from the beginning. So you have an individual that has symptoms. They go and they get a test for COVID-19, and that test could be a rapid test, that test could be a PCR test, and if those tests are positive, then we are going to do a case investigation, and that is reported to the health department. That could be reported via a laboratory, or it could be reported by a physician or a clinic as a positive test. So whenever you have a positive test and you are considering someone a case, you begin a contact investigation. And what that looks like is we are calling the individual that is a case. We are discussing with them when their symptoms started. And we will move 2 days before, 48 hours before their symptoms began as far as a contact investigation. So you have an individual that had a cough on Wednesday. We are going to talk with them about who they were in contact with the 48 hours previous to when they started having symptoms. And when we talk about who they were in contact with, that basically means sharing an airspace with someone within 6 feet of that individual for at least 15 minutes. And that can be cumulative, or that can be in a one-time type of airspace sharing. So that is an individual that is a contact. So we go from that time, that 48 hours before that individual became symptomatic, to the time that they isolate. So that's how we develop our contacts to a case. Now, if you have an individual that has no symptoms, but they had a test for some reason, so maybe they were going to have surgery or they were going to travel, and or maybe they were a contact to a diseased person and it's been 7 days since they were in contact with that person, it was recommended they have a test, but they're asymptomatic, we start from 2 days before they had their test for contact to disease until we isolate that individual. So when somebody is positive and they are considered a case, they have to isolate. So we've talked about that investigation piece of the 48 hours before they were symptomatic, or the 48 hours before they had a positive test, to the time that they isolate. Those are those contacts to a case. But the individual that is a case, they have to isolate. And that person has to isolate for 10 days from the time that their symptoms started, or 10 days if they're asymptomatic and from the time that they had their test. Throughout that whole time, they isolate, they're away from others, they reduce any type of contact with anyone, and if they absolutely have to have any contact with anyone, they must wear a mask. But that is also discouraged, that they just, isolate. They stay away from others. So that's the isolation frame. They can be removed from isolation after that 10 days, and they have to be fever-free for 24 hours from that last date. So day 9 through 10, absolutely no fever and no medication that could impact a fever. If an individual is asymptomatic when they're tested, and then 5 days after they're tested, they become symptomatic, then they have to isolate from that date of when symptoms begin. So if I'm asymptomatic when I'm tested, but yet 4 days after that I become symptomatic, my isolation date restarts from the time I become symptomatic. That is sometimes something that people don't think about, because they think, hey, well, I was asymptomatic when I tested, but you're no longer asymptomatic. When you become symptomatic and you are a case, that you cannot be released from isolation until 10 days after those symptoms begin, and absolutely no fever for 24 hours for the last day of isolation. So quarantine. The difference between isolation and quarantine, isolation is for individuals that are cases, individuals that have a positive test and positive test and sick. Quarantine is for those individuals that are contacts. So we talked about contacts to a case, And so individuals that are a contact to a case, they have shared airspace with an individual that has disease. And so we ask them to quarantine for 14 days after their last exposure to that individual. The reason we ask individuals to quarantine for 14 days is because of the incubation period. So I could have been exposed on the first of the month, and I can break down with disease anytime between 2 to 14 days after my exposure. Individuals can test at any point during that quarantine period. Really, after exposure to disease, the best time to get a test is between 5 and 10 days, and the real sweet spot as far as getting a test is around 7 days. So that is fine. You know, we tell people, if you're going to test after you've been in contact to disease, you know, really look at that time frame as far as when you're most likely to become positive. Regardless of what that test result is, the individual that's a contact to a case must continue to quarantine for 14 days. You can test every day from day 2 to day 14 in a quarantine, and it doesn't matter, you still need to quarantine. You do not get released from quarantine with negative tests. So that is a common misconception. We also talked about being released from isolation, that 10-day time frame. That is for all individuals. There used to be a test-based release from isolation for certain groups. There still is, but it's very unusual to use that. Now CDC recommends that symptoms and time-based removal from isolation. There is a population that is very high risk that CDC recommends a 20-day isolation period for those particular types of cases, and that individual will be notified of that by their physician and or by the public health official that does that case investigation. It's unusual, but it is very much recommended for certain populations that are at high risk for issues and that have comorbidities that are very concerning.